Now, there's a growing campaign to save 8 NHS walk-in centres in Birmingham and Solihull. The future of the clinics is in doubt as part of an area-wide review into emergency care.
The centres allow patients to see doctors without making an appointment. The Solihull and Birmingham Health Trust says duplication between them and other NHS facilities isn't value for money. More now from BBC1's political reporter Elizabeth Glinker.
We don't always get ill during office hours. When Melanie and Paul Flynn's twin girls were sick over a weekend, they turned to their local walk-in centre. Doctors there found severe chest infections and sent them to hospital.
It's absolutely vital, isn't it? Yeah, because there's a lot of conditions that aren't serious enough to want to take a child straight to A&E, but you still need medical care available. I don't know what we'd have done in that instance if they hadn't been able to have nebulisers straight away, because they were quite poorly by the time they got there.
Now the future of that centre and others in Birmingham and Solihull is in doubt as part of a review of emergency care. The MP for one of the areas affected raised the issue in Parliament this week and says the centres are not the place for the NHS to make savings.
It would be bad news for the public and the economics of the madhouse if walk-in centres were to close all over Birmingham. Bad news for the public on the one hand, because you need access to high-quality medical care 7 days a week. Economics of the madhouse on the other hand, where would people go? Accident and emergency, and that costs the public purse more.
Walk-in centres mean patients can see a doctor without an appointment. Some say they're expensive, but in Erdington today there was clear support for the service.
I've had times where I've phoned up the doctors. I've had to wait 3 weeks for an appointment. To me, that's wrong, where at least you can go into the walk-in centre and you can see somebody straight away.
It's handy to have it there if your doctors aren't available over the weekends or if you can't get an appointment.
Campaigners say they've already gathered a petition of over 3,000 names.
We're determined that we'll convince local NHS managers that this service is essential to people in Erdington. The local NHS managers have said they want to simplify access to local health care. Well, we can't see what could be more simple than you walk in and you get seen.
There are 8 walk-in centres, including this one in King's Standing, which face an uncertain future. In a statement, the clinical group responsible for the review told me that they want to be clear that no decisions have yet been made and that they're talking to patients and doctors about how best to improve emergency care in the area.
A public consultation is due to get underway this spring. Elizabeth Glinker, BBC Midlands Today, Birmingham.
It's approaching 6:45. This is our top story.